89.9 KMOJ, the People Station. Twin Cities is 33 after the 1 o'clock hour. I'm Glam Life Kim, and today it is time for Minneapolis 360. I got my favorite guy in the building, Mr. Anthony Taylor. How are you today?
I'm good, sis. You know, it's always a pleasure to see you, as always. I miss this time when I don't get a chance to connect with you.
I know.
So I'm always happy and blessed to see you.
Me as well. I was a little nervous because with the shutdown, I was wondering, I'm like, are they going to let us come into the radio station?
You know, when you shot me that text, I'm like, oh, please. I'm like, let the show happen, right? Because especially with all the topics we talked about throughout the year and a half, I think this is the most important time for us, right?
Yes. It's imperative that the city knows and the community knows what is going on.
It is imperative that the city knows. And Minneapolis, I want to thank you. My name is Anthony Taylor. I'm the African-American Community Specialist for the city of Minneapolis. I am glad to be with you today. We are going to talk specifically about COVID-19. And I think this is a very, very important topic because obviously things are happening worldwide that's affecting our entire way of life. All through the country, all through the world, and specifically the Twin Cities, we and myself wanted to give you some information about what COVID-19 is. And I got the perfect person to come on and talk about this topic and how it's affecting our community is April Graves. But before I introduce April, and she's going to give you some really good information about COVID and how it's impacting us in our community, I just want to give folks some information that they may or may not already know about what's going on, right? So when we're talking about the coronavirus, COVID-19, it is in all 50 states now. So the health officials continue to confirm new cases in Minnesota. So last week, both mayors of Minneapolis and St. Paul declared local public health emergencies to respond to this threat. The declarations grant additional powers and authorities and responsibility to mayors. And these declarations are in addition to the state of Minnesota peacetime emergency declaration. So if you say what that means, right, what it affects what's closed. And I think a lot of you know this, but still we want to give you some information about it. What is closed are all schools are closed, and that includes universities as well as K-12 education, restaurants, food courts, cafes, coffee houses, and other places that consume food or drinks on the premises. All salons and barbershops are closed as well. Now, this was ordered this Friday through Governor Walz, and he indicated that there may be continued closings beyond this week. Now, what it could happen, there's a lot of states that are doing a shelter-in-place order, right? Specifically from my home state of Wisconsin, how that reaches me close, they have started that too as well.
Did they? They shut everything down in Wisconsin?
Everything is shut down in Wisconsin. Right now, the governor has not declared that, so we're not saying that. But as this virus continues, there are daily and weekly updates that will happen, right? So also, in addition to schools closed, parks are closed through April 5th, and in St. Paul, March 27th. Also, libraries are closed through Hennepin County through April 6th and then March 23rd in Ramsey. Now, places that are open that you can still do business are restaurant takeout. Remember, takeout. So you can't go in and you cannot dine. Drive-through windows, curbside only, absolutely, Kim. Food trucks and grocery stores. So these are consistent with guidelines from the CDC, Minneapolis and St. Paul, and any gatherings over 50 people aren't allowed.
Right.
Okay, so we want to just really be clear on that. I know this is a tough time for a lot of folks, but as being on KMOJ and the city of Minneapolis' commitment is to give you vital information and resources on everything. So we can talk about putting a lot of what the city has provided on this show to specifically talk about this and how it impacts our community. Right. So it is important that you listen, folks. If you need to call in, please do. We have some time to answer a few questions. Okay. Absolutely. But I want to bring my guest in because she is a person who is really, really entrenched in getting a lot of this information to the public and also behind the scenes working in Minneapolis to make sure that we can function. Right. We give resources to folks and just really some vital information to the community. And I got April Graves here from the health department. April is a brilliant queen. She does a lot of good work. And I want to ask April this question. So first, thank you for coming.
Thank you
on
for
the
having
show.
me on the show.
I'm so excited, first of all, to get out the house, right?
I have to say, it does feel good to move around a little bit, but, still trying to be smart and responsible about how we get out and how we're interacting. We're trying to practice social distancing right now here in the studio.
Absolutely, and we're doing a really good job. I mean, I usually give Kim a hug. I didn't give her a hug. She didn't give me a hug today, but when this is over, I'm a bear hugger.
Right.
So I'm just going to be honest with that. So April, just tell us about what we should know about this COVID-19 and this infectious disease.
Okay, so according to the Center for Disease Control and Prevention, or the CDC, most patients with confirmed COVID-19 or coronavirus infection have had mild to severe respiratory illness with symptoms of fever, cough, and shortness of breath. Some patients have had other symptoms, including muscle aches, headache, sore throat, and diarrhea. The Center for Disease Control and Prevention reports that those who have been infected have had a range of illness severity, from mild to severe. A very small percentage of those infected have died or had severe illness.
So let me ask this question, and that's a good question. How can you determine if this might be symptoms of COVID-19 or flu-like symptoms? How can people tell the difference on that?
Honestly, I don't think that there's a really, really good way to tell the difference, and I think that's why they're telling us to practice the social distancing. You could not have any symptoms and actually be infected with COVID-19, or you could have some symptoms that you're not sure whether that's related to a cold or to COVID-19, and that's why the importance of social distancing is out there, because we don't know. What we do know is that we all can spread it, and those that are most vulnerable are the ones that are going to be most impacted and likely to develop severe complications. So the best case is to kind of move as though you have it, whether you have symptoms or not, and practice the social distancing. And some other ways you can protect yourself are by washing your hands very thoroughly with soap and water for at least 20 seconds. To cover your cough and your sneeze, ideally not with your hands, right? Cover it with the crook of your arm, or maybe you could have a tissue or something. Avoid touching your face when your hands are not washed, so that way if you did come into contact with something with your own hands, you're not spreading it onto yourself when you touch your face. Stay home when you're sick. Don't go out, and if you absolutely have to, try to get someone else to go and do it for you so they can bring some things back for you. And of course, stay informed. Listen to KMOJ, check out the city's websites. You can also use the Minnesota Department of Health website, www.health.state.mn.us. This website also has information available in Spanish. That's www.health.state.mn.us. You could also visit the Center for Disease Control and Prevention, the CDC's website. That's www.cdc.gov/coronavirus. And there's also resources on the City of Minneapolis page that you can access at minneapolismn.gov/health/preparedness. That's minneapolismn.gov/health/preparedness.
And what we'll do is we'll make sure that folks, we repeat this information again as well before the show is over. But I want to go back to something that you said that I think is important and talk a little bit more about social distancing, right? I think a lot of times people think that that's not one of the most important ways to prevent the spread. And you were sharing a story earlier about how that can get into folks' hair, right? Talk a little bit about why that's important to practice social distancing, and some people really don't understand that.
Well, I'm going to go over just some facts about it, and then I'll speak a little bit about it from a personal perspective, and because I recognize that it's not an easy thing to do. So first of all, social distancing is a way to keep people from interacting closely or frequently enough to spread an infectious disease. The Center for Disease Control, the CDC, thinks the main way that COVID-19 is spread is person to person. So groups of people can contribute to this. Someone in the group gets the virus from another person. Then the virus gets introduced into the new area or the new community when that person moves into another group. So to prevent this, it's advised to put at least 6 feet between yourselves and others while you're out in public. That includes if you're out at grocery stores. So different grocery stores should be practicing to the best of their ability social distancing in their locations. Find a way, put up signs, use pieces of tape to create corridors so that the people can move through and get their groceries in a safe and organized manner. Should also just avoid crowded places. The Center for Disease Control and Prevention has recommended limiting gatherings to no more than 50 people. And I think, frankly, 50 people at this point is too much. I have not had any gatherings with any of my extended family. My 23-year-old son works for a car dealership and is still working. Many of us are still working out in the community. And because of that, my son isn't able to come and visit me. And that's hard, for me to say, no, you can't come see us. I want to see him. Mm-hmm. It's very difficult as a mother. I want to protect him, even though he's 23. But just to keep myself safe and my kids safe and my elderly mother safe at home, he can't come over, and neither can any of our other family members. The same goes for anybody else's household. That's part of being responsible and also not being selfish and thinking about other people and the potential that you have to spreading this disease to them and the possible impact it could have on them and their family. So you should always be prepared. Do your best to have enough food and get your regular prescription drugs and other necessities on hand in case you need it and you have to stay home or you're not able to easily go out. Make plans to care for other sick household members and know what you do if there was a closing of your child care program. The city, like I said, has health emergency preparedness home care guides online. That's at minneapolismn.gov/health/preparedness. And there's lots of other resources that I've been working on with other colleagues at the health department in response to this. We're creating a new branch of the emergency preparedness response with the intention of elevating community power. We know that there's amazing work going on in the community. I've seen a lot on social media from many different groups that are doing super, super important work right now, feeding our elderly, feeding our disabled, making sure that there's child care and that people are getting their essential needs met. And so I really want to elevate those stories and bring those back to the leadership in the city to make sure that we're supporting the community on the ground as they work to combat this really difficult, still developing situation. And one thing I think that's super important to remember, too, is that as we're all thinking about one another, we also have to think about ourselves, making sure that we're taking care of ourselves. Don't spend hours and hours and hours on social media. Your anxiety levels can really go up, and when you're mentally and emotionally fragile, it can affect your physical health. So do things, that uplift your spirit. Sing songs, play games with your family. If it's sunny outside, go sit outside on your front stoop or on your back deck and soak up some of that sunshine. Remind yourself of all the things that you have to be grateful for. Like even myself feeling sort of overwhelmed with this response from the health department and my roles in other places, because I live in Brooklyn Center and I serve on the city council there as well as being a mother. I'm also reminding myself how much I have to be grateful for. I'm not out in the community in a job where I have to interact constantly, and I know that that's a privilege that I hold. And so I'm trying really hard to show up and do the best that I can and work with the people in the community and in the city to make sure that we all have the resources that we need and that we have the lines of communication that are necessary to respond in the most effective way.
Yeah. I was at Menards yesterday, and they have the X's marked every 6 feet. So while you're standing in line, it's real serious. So
absolutely, a lot of places are doing that too.
Are they marking them?
Absolutely, and I'm glad to see that. I'm glad that you said that. Absolutely, and April, I'm really glad that you shared some of your personal story, because it affects everybody's lifestyle, right? And really what I take from April saying what she said is that we have to change the way we live, but we also have to make sure that we take care of our bodies, our minds, and our spirits, right? And we can't let our spirit be attacked because of this virus. So what do you do? What are some of the most creative things that you can do in this times? Now, granted, Minneapolis, I know that this is not easy for everybody, but what I got from what she said is that we have to make sure that we're mentally connected, spiritually and physically connected still as we go through these tough times. Right. So being creative with yourself and your family. Minneapolis, I went back and got an old Nerf basketball hoop.
Did you?
You know what I'm saying? Those old school hoops where you can hang it on the door, you can shoot.
I need you to post that picture.
I'll do that, right? But it was something that I haven't done. I just wanted to be a little bit creative with that.
Right,
so,
right.
And I appreciate you sharing that's
different ways.
Absolutely, to be able to take care of ourselves, right?
Mm-hmm. I've noticed a lot of people online too, like DJs. They're they're like streaming live their music. I've seen event planners like just doing balloon work and just practicing. I mean, whatever it is that you've been dying to do that you haven't had a chance to, do it.
Right. I mean,
now's the time.
Yeah, I lead a yoga class every Sunday, usually in person. And this past Sunday, I did my first live Facebook Live yoga class, which was a work in progress. But I plan to keep doing that every Sunday. And there's lots of other yoga practitioners and spiritual well-being practitioners that are offering free classes online. So I encourage all of you to take advantage of that or start your own.
I would like to.
I'd
like to take advantage of your class.
I thought about that too because I'm usually pretty active and I'm trying to find different ways.
Let's do it.
To do that. Absolutely.
Join April's class.
One thing that I want to talk about too that I think is important that's happening is our small businesses and businesses being closed and the impact it has on the people and the economy in our city. So this is some of what the state is offering, right? So Governor Walz has signed an executive order to that effect, right? So one, he's suspending eviction proceedings during the COVID-19 peacetime emergency. So tenants can continue to pay rent during this emergency and they should continue to do so. This order prevents landlords and financial institutions from bringing proceedings that remove people from their house during this time. And more information is available at mnhousing.gov, right? So, folks, you can't get evicted, right? Financial institutions cannot bring proceedings on you during this time. So, reminder of that's really important. Also, too, the emergency loan program for small businesses affected by COVID-19 pandemic. So being forced to close makes it hard on restaurants, salons, barber shops, beauty shops, everything. So the program provides some immediate assistance to those business owners, and that information is on the website at mn.gov/D. If your employment has been affected by COVID-19, you can apply for unemployment benefits. That information is also available at mn.gov/D. And as we know, tax time is usually coming around April 15th. Now, listen, I know a lot of us, that's not even the first thing that's on our mind, right? Is tax time. But it is now extended through July 15th. So that's both state and federal taxes. Awesome. So I think that's important for folks to know because there's a lot more important things on our plate, right, than worrying about filling out taxes. So I just want to be clear how that things are in place that can help folks during this time. So I definitely want to make sure people understand that. And also many parents, too, are working to find ways to take care of their children, right? Finding creative things to do. April talked about it. Glam Life talked about it, too. Now, this may be a little expensive, but I just want to put that out there. So the state of Minnesota is partnering with the YMCA for child care for children kindergarten through 6th grade at $40 a day. There's 38 locations in Minnesota that are taking in this. Priority is given to children of emergency workers. That includes educators, grocery store workers, utility workers, essential state and local government staff, and other professions. So there's more information available at ymcamn.org/mnchildcare or by calling 612-230-9622. So there are different places that are able to provide a little bit of child care if you can afford that. To me, that's just a little bit expensive.
Yeah, $40.
$40 a day is a lot, especially for folks who aren't working. But it gives you an opportunity to be creative if this is not something that you can do. So really want folks to kind of understand that. And things are changing, right? Information changes constantly. So I want to make sure that we gave you a lot of information on a lot of different websites. So we'll repeat some of those again. I'll also give you my information. You can reach out. You can email me, and I can gladly send you more information. But visit these websites, right? The Minnesota Department of Health is at www.health.state.mn.us. It's one of the most helpful websites that you can go to get information on resources throughout this time, and also always with the CDC at www.cdc.gov/coronavirus. And the Minnesota Department of Health also has a hotline that you can call at 651-201-3920. That's 651-201-3920.
I also have one more webpage that is being put together by the city of Minneapolis that is compiling different resources and links onto one webpage. That's minneapolismn.gov/coronavirus, CORONAVIRUS.
And when in doubt, of course, you can visit KMOJFM.com, and I'll make sure that all of these websites are listed on our site as well. So that way, if you guys, just need to click on the link and go straight to it.
Beautiful.
But we'll always keep you informed as well.
Beautiful. And I really appreciate KMOJ. I've been listening to KMOJ a lot lately, right? Always
Good.
do.
Right.
But just lately, and KMOJ does a really good job of giving out information. The message I heard Freddie Bell just driving in, right, is that we'll get through this.
Yes, we will.
We'll get through this. Tough times don't last, right? Tough people do.
Yep.
And what I really want to make sure that I leave you with today, and I'm going to throw this back to April and Kim, actually, is that when this is over, right, things will continue. Right. What I really want to make sure people do is don't let these times affect relationships, right? Don't let them affect relationships with your children, with your partners, with your family, because this will be done. But relationships last forever. So when someone says, listen, Anthony, you can't come over and play spades, even though I'm bored out of my skull, right? It's to protect my family and to protect the ones that I love. So we can't let those things ruin those relationships. Absolutely. And that's one of the most critical things that I've been thinking about over the last week and a half. And I want to make sure that my relationships are intact. So if I seem a little bit social distant, right? If I seem distant, just understand that, right? So April, and I'm you too, Kim, what is one of the most important things that you want to leave folks today out of everything that we share? What's one of the key things that you want folks to really understand about this COVID-19 pandemic in our state and our city?
I mean, I guess for me, I think that it's sort of twofold. It's an opportunity to kind of turn inward, right? To focus on yourself, on things that maybe you oftentimes aren't focusing on because you're busy and you're finding other distractions and other ways to not do some of the inner work that we all can do to grow spiritually, intellectually, as people in purpose in this time, in this life. But I also think that it's a time to delve deeper into those relationships, just not in the same way that we always do. Sometimes it's easy to just kind of have surface relationships, but this is an opportunity to deepen those relationships in a different way. So some of the things that I've been practicing is just doing daily check-ins, even if all it is like a text message to, 5 to 10 people in your network that you send out every day, like, hey, just thinking of you, hope you and the family are doing well. I know when I get that kind of a message from someone, it lifts me up on a regular day, and especially in times like now when we know that we aren't having the same level of connections that we typically do in person. I think it becomes even more important. So just spreading those messages of love and well-wishing, checking in on your loved ones in the ways that you can, and making sure that you keep checking in with yourself so you can keep showing up for your roles, for your responsibilities to the best of your ability. Because when we take good care of ourselves, we take good care of each other.
That's
Absolutely.
Beautiful.
That is. We do have a caller. Do you want to try to take this?
Yep. Go ahead.
Right. 89.9 KMOJ.
Hey, how you doing today?
Good. How are you?
Good. Some of you mentioned, I wanted to just bring it up. You said that schools were closing or closed. They're trying to adjust for our children.
Yeah, he said, what's your name, brother?
Coach Steve from the North Side.
Coach D, we appreciate that, and that is very important. It is very important that parents, grandparents, aunties, uncles, if you need to help a family member out, make sure that you contact the schools because they are, helping you guys. I even heard that they are offering free Wi-Fi for some households who don't have it so that the kids can, continue to hop online and continue to get the assistance that they need.
Yep, and thank you for sharing that. And I think that's important. And one thing too to remember that the baby's mind still gotta learn, right? So how much you can feed our babies information if the schools are giving laptops. But this might be a time to get your long division on if you ain't really, if you struggle with it, right? Maybe you can, get that practice in with your
or
babies.
Or even just doing something different. Like, I don't know how many people have board games at home, but I had a great time the other day playing memory with my two daughters, my 18-year-old son and my mother. We all sat down and played a memory game.